Good morning, everyone. Dr. Sean here, and welcome back to my channel. The reason for this clip is basically to just let you know that I've done a full deep dive on my recent blood results that I had done about a month ago. And there was a bit of a surprise in there. I'm not going to go into any more detail in this clip, but I just wanted to say the deep dive video is up on YouTube, and I will share the link at the end of this clip. Just a quick look on the tests that was performed. Renal profile, lipid profile, limited endocrine profile, limited liver and bone profile, micronutrient test, only vitamin D, vitamin B12, red blood cell count, white blood cell count, and cardiovascular health. The big one that stood out for me on my blood work was in my endocrine profile, and that's metabolic. So my thyroid function, TSH, and free T4 were fine, as indicated on the screen. It's my blood glucose, my blood sugar, that was elevated. And as you can see, it says pre-diabetic. So I will explore that in a lot more detail in the full video in my deep dive. And the take home for me really is the elevated blood sugar, which is measured by the glycated hemoglobin, the HbA1c marker, highlights the need for lifestyle changes. So we're talking about diet, nutrition, just eat better, eat a balanced diet. This clip and the deep dive is not going to talk about nutrition and diet. I can do a separate video on what I will be doing to try and bring my blood glucose down back in range, but I'm just going to share my blood results in the deep dive. But that is basically the take-home message for me. All the other blood results I will explain, well, I have explained in the deep dive, so you can catch it on the full video. I just wanted to give you a snapshot of some of the stuff that I have covered in the full video. So I went into a little bit more detail on blood sugar and insulin, and in this diagram it just basically shows the process of what happens when there's a hypoglycemic level within your blood, so high sugar, and that's the process that's followed. If you are low on blood sugar, so your levels are lower than normal, and that's the process that's followed. So this is through the liver, through your cells, where the pancreas releases insulin, the beta cells, the insulin, and the insulin acts on various other cells and structures in the body to try and take the excess glucose out of the blood and into either the liver, store it as glycogen, use it in the cells for energy, convert it into ATP, which is the energy source used by the cells, or store it as fat cells, and in the muscle as well. It can be stored and it can be used. So this is just basically explaining, and that just means in my case something is not working properly, and I will explain that in a lot more detail on the deep dive full video. I then talk a lot in a lot more detail on insulin resistance and how that relates to diabetes through this diagram. And then I explore insulin resistance and how it relates to prediabetes and diabetes. So going from a normal function through insulin resistance, then prediabetes, and on to full-blown type 2 diabetes. On this particular slide in the full video, I discuss the blood sugar and how genetics play into that. And in my case, there is a genetic predisposition for me due to my family history that links to insulin resistance and then diabetes. So it's quite a personal thing, and I didn't realize that the genetics would be such a strong indicator in my case. So it's quite interesting to explore that in a lot more detail. And I will be talking through all these different bullet points and what can, be done and why genetic predisposition matters. I've also decided to talk about ethnicity and insulin resistance. As I was doing my research, I found a lot of information talking about how ethnic minorities, those of African and East Asian populations, actually have a higher incidence and a higher chance of becoming insulin resistant, have lower insulin sensitivity, leading to prediabetes and diabetes compared to Caucasian population. So I will explore that, maybe as well as the genetic factors involved and environmental and lifestyle factors that plays into that as well. For those who recall, when I did one of my previous videos on the channel about sleep patterns and the link between sleep, poor sleep or disruptive sleep and chronic disease. And I think on that video there was, I don't remember if type 2 diabetes or pre-diabetes or insulin resistance was actually on that video in one of the research papers I reviewed, but there was something on being overweight and obesity. So coming back to that, there's definitely a relationship and a correlation between poor sleep and insulin resistance and diabetes, and I will explore that on this particular slide in the full video. In the full video, I also explore the role of chronic stress, socioeconomic stress, and discrimination and racism and its effect on insulin resistance and diabetes. So at the end of the deep dive video, the most important take-home messages for me and what I would like, all of you to actually, take heed of is make sure you have regular health checkups. Make sure you do your follow-ups with your medical team, with your doctor, and please be proactive with your health management. Out of the deep dive, I try to explore the role of ethnicity, family history, genetics, and epigenetics in insulin resistance and diabetes. I also try to tease out some of the risk factors that play into insulin resistance and diabetes. And obviously, the call to action would be, if there's anything that is a trigger or anything that is concerning, based on what I've shared in my full video, even if it is not specific to insulin resistance, diabetes, or prediabetes, but some of the other biomarkers that I've discussed, please speak to your doctor or your healthcare team. As promised, on screen, a link to my video, Deep Dive My Blood Results. If you navigate to my full video, you'll see that it's an hour and 17 minutes long. If that's a bit too long for you, I've included timestamps in the description box below my video, as well as the first comment on the video. I've basically just put all the timestamps in there, and I've labeled them all so you could actually navigate that better if it works for you better that way as opposed to watching the whole video. But I do implore you to actually watch the whole video, as I cover a lot more detail on a range of different blood tests, and I've included some links and resources on the internet and on YouTube that I think you'd find helpful as well. So I'd like to thank you for your time, and I'll see you in the full video.